Assalamu alaikum everyone. My name is Sana Rehman and I am going to teach you DSM-V-TR. As all of you know, DSM-V-TR has been published in 2022 and it is very crucial to understand the key changes in DSM-V-TR for the better diagnosis, assessment and management of your client. So we shall be covering all the points of DSM-V-TR in details. So let's get started. Before starting the detailed lecture, I would like to provide the key points of the lecture, and I would like to give a brief overview of today's lecture. So in today's lecture, we shall be covering the introduction to clinical psychology, and all of you know it is very important to understand the definition, the activities of clinical psychologist, and key terminologies of clinical psychology for better understanding of DSM-V-TR. Without understanding the definitions of clinical psychology and without understanding the even terminology, it would be hard for you to understand the revised manual, because there have been addition of new terminology which is very crucial to understand for all of you. So, apart from clinical psychology and terminology, we shall be focusing on specifically on DSM-V-TR, and in DSM-V-TR, we shall cover the major classification of DSM-V-TR, the development of DSM-V-TR, and the key conceptual framework and approaches. Furthermore, we shall be focusing on the types of information in DSM-V-TR. Basically, DSM-5 has three key sections, and the first section provides the information related to introduction of DSM-5-TR, and the second section covers the all the details related to disorder related changes in DSM-5-TR, and the third section of DSM-5-TR covers the emerging measures and modules related changes. So in after having an overview of clinical psychology and terminology, we shall be covering the all three sections, what changes have been made in DSM-5 overall. So this is the overview of today's lecture. Now get back to the first point, which is introduction to clinical psychology. Students, as all of you know, clinical psychology is a subfield of large discipline of psychology. Psychology has many branches and clinical psychology is one of them, and it is in trend because many people in the contemporary world experience depression, anxiety, stress and many other disorders. So it is very much important to be expert in clinical psychology to assess their problem and to provide the relevant treatment. So in clinical psychology, a professional or a clinical psychologist primarily focuses on the diagnosis, prognosis, etiology, assessment and management plan. For diagnosis, DSM-5-TR provides us a very, authentic classification of diseases. We can easily identify if a person is suffering from neurodevelopmental disorder, schizophrenic, personality, psychotic symptoms, mood disorder, bipolar disorder, neurocognitive disorder, and other multiple disorder can be identified through diagnosis. So a clinical psychologist must be a very expert in understanding and giving the diagnosis to their patients. Furthermore, diagnosis is not sufficient, alone is not sufficient, but it is also very important to identify the prognosis or chances of recovery. If a person is suffering from schizophrenia, or if a person is suffering from mood disorder, at what severity level is he, or how we can help them out, what are the chances of recovery that he can get out of this disorder or particular symptom. So he must be an expert to make prognosis as well. So apart from making prognosis, etiology is also another important aspect which tells a psychologist or the client that what are the key features or key causes which are contributing to the mental health issues or leading towards the severe mental health issues, so that these causes can be reduced or root out from the society. Furthermore, apart from etiology, he must be expert in assessment, both kind of assessment, the formal and informal, and he must be familiar with the management plan. Management plan comprises of many theoretical assumptions. There are multiple types of therapy such as cognitive behavior therapy, behavior therapy, dialectic behavior therapy, acceptance and commitment therapy, now lifespan multi-integration program also have introduced a memory-based intervention. So every day, management plans are growing with high scope, and people are the expert are using it with high skills and producing the fine results as well. So, all type of diagnosis, prognosis, etiology, management, and assessment plan can be made based on what type of disease the person is suffering from. For example, if he is suffering from emotional problems, behavioral problems, cognitive and psychological issues, all types of disorder can be assessed and even treated using multiple assessment and management modalities. So the entire course of clinical psychology is not an easy job because high skills are required in each steps. So, if we talk about, it was a layman description of clinical psychology, but if we talk about the formal definition of clinical psychology, so I'll be sharing the two very authentic definitions with you. The first one is given by American Psychological Association, and according to them, clinical psychology involves the provision of diagnostic assessment, treatment plan, treatment prevention, and consultative service to patients of an emergency room, inpatient unit, and clinics of hospital. If a person is suffering from severe mental health disorder, or he is suffering in or he is living in rehabilitation or a clinical setting, so different type of diagnostic assessment, treatment plan, and treatment modalities can be offered. But if a person is self-referred, or he is having minor issues, he can perform his day-to-day functioning well, but sometimes gets disturbed due to the minor symptomatology, and he is not living in any clinic. So different set of treatment and prevention modules can be used. So this definition provides the entire role of clinical psychology, how it can serve the patients and the people who are suffering from any kind of mental health issues. But the second definition is a bit more versatile because it has been given by Canadian Psychological Association, and it primarily focuses on the two aspects. The first one is the field of practice of clinical psychology, and the second one is research. According to the Canadian Psychological Association, clinical psychology is all about practice and research. If a person is good in research, he can, identify the new invented evidence-based therapeutic approaches to treat their, patient. He can get familiar with the advanced assessment tools, advanced prevention, techniques to heal their patient. Also, this definition stress upon that what kind of problem a clinical psychologist or clinical psychology can deal, which is psychological distress, disability, dysfunctional behavior, and health risk behaviors. As these type of disorders, clinical psychology is covering a versatile kind of disorder, and but our focus should be on DSM-5-TR. It's just an overview, therefore I'm not going into too much details of the definition. So let's move towards the next point. Okay, so briefly we shall be discussing the activities of clinical psychologists. Basically, clinical psychologists perform versatility of functions, but here I shall be discussing the 5 key roles or activities of clinical psychology. And the very first activity the clinical psychologists perform is the assessment. The clinical psychologists gather information on individual regarding their behavior, problems, abilities, characteristics, intellectual functioning and personality. It is very much important. If a person meets you, either he is with you for their behavioral problem, either the behavioral excesses or behavioral deficits. For example, if he is having a behavioral deficit, so he must be complaining about the low mood and attention deficits behavior and lack of energy. But there will be some other kind of problem which shows a behavioral excess of the patients. For example, hyperactivity or high substance abuse. These type of disorder represent the excess of behavior. So both kind of behavior which crosses the mainstream, either it is in excess or in deficits, leads to problematic behavior. And clinical psychologists identify if the behavior deficits are there or the behavior excesses, and for in both circumstances different set of therapeutic modalities are available to treat their mental health issues. Furthermore, what kind of problem he is complaining about. For example, he is having irrational thoughts, he is having repetitive behavior. So what kind of problem he is suffering from can also be assessed through different formal and informal assessment modalities. Again, it is very much crucial for a clinical psychologist to identify what kind of abilities a person have. If he can cope up with the stressor, if he has ability to, reduce his or her stress, can also be helpful to identify the better management plan. And furthermore, the characteristics, intellectual functioning, and personality traits can also help them out to understand how a person can help them out to or work collaboratively to reduce their symptom severity. Okay, so again, how the question arises, how a psychologist can, gather all these information. So the very first point, the psychologist can gather all this information through clinical interview. And all of you know, clinical interview and administrative tests both are very important to produce better results and to get in-depth information about any problem. So yeah, apart from this, we can also see the assessment procedure in two basic categories: formal assessment and informal assessment. So clinical interview basically is considered an informal assessment in which we observe verbal and non-verbal responses of the client, because sometimes the client himself doesn't know what is wrong, what wrong is going with her, and how he can come out of the symptoms. Furthermore, if the person is not able to identify his or her problem, and the client is not able to understand what wrong is going with his client, so he can administer some test, reliable and authentic tests like projective and non-projective. Both tests can help them out to identify the root causes and the accurate nature and level of their dysfunctional behaviors. So because it is not, again, the course is about assessment and management modality, therefore I'm not going into too much detail. We shall be more focusing on DSM-5-TR changes. Okay, the second key role or key activity of a clinical psychologist is to provide effective treatment modality or effective management plan. So, a better clinical psychologist have the ability to identify a person, nature of problem, and what kind of treatment would be more suitable and effective for the patient and for his personal, social, and occupational improvement. So, as all of you know, it is very hard, or it is very skillful, task to be mastering any therapy or in any therapeutic module. So the clinical psychologist identify and use multiple theoretical approaches, but the most commonly used approaches are cognitive behavior therapy, psychodynamic approach, and humanistic approach. It depends on the nature of the problem, what uh, treatment modality or therapy would be more suitable for the management of their issues. If a person is suffering from issue like he's hopeless, he can't see, he can't see anything positive in his life, so cognitive behavior therapy would be more suitable to modify their negative automatic negative thinking patterns. And if a person is suffering from relationship oriented problem, or he is having some childhood bad experiences, so psychodynamic approach or psychotherapy would be more suitable for the person. So therefore, like, there are hundreds of therapies, so it depends on the nature of the problem, and a clinical psychologist try to find out the key suitable therapy. After providing the treatment to their patients, uh, the clinical psychologist always focuses on two types of treatment modality. Either he is dealing with the inpatient or outpatient. If he is dealing with inpatient, so most of the time behavior therapy is considered more effective, like, because they can use behavior change, behavior modification oriented therapies, token economy, reinforcement, punishment. These are some mechanical which we can use with the inpatient who are suffering from, like, developmental disorder, neurodevelopmental disorder, or maybe cognition oriented disorder. But outpatient, because most of the time experience less severe problems, so their issues can be treated with cognitive behavior therapy, humanistic approaches, acceptance and commitment, and many other advanced therapies. So yes, he must be a master in providing the treatment. Okay, which method the clinical psychologist would be using for the management of their patient depends upon a few points. First of all, clinician theoretical orientation, how he understands the nature of the problem. If he is expert in understanding, then he is suffering from this type of problem, and for this type of problem, that particular type of intervention will be more suitable, and he has some conceptual clarity about that. So the treatment method depends purely on theoretical orientation. Furthermore, it depends on what method we shall be using, or clinical psychologists would be using based upon the client problem. Like, if the problem is severe, so different type of therapies will be used. If the symptom severities are minor, so again different set of therapy will be used. Apart from this, is client adult or child, uh, again, for both children and adult, there are different sets of therapy. Furthermore, if a client is outpatient or in a facility, different set of intervention can be provided. Does the child need medication? Yes, it is important. If a person is suffering from schizophrenia and also he is under medication, so the treatment therapy, so combination of therapeutic treatment would be very different with the patient who would not be using any medication. So again, I'm sharing the brief information because I need to move towards the DSM-5-TR changes. So let's move to another topic. Again, research. While my topic is DSM-5-TR, my topic is DSM-5-TR changes, but still the research-oriented points are very much important. It is the key activity of clinical psychologists to have an expertise in research, because if a psychologist does not have a good research skills, he cannot be aware with the advanced therapies, the efficacy of treatment, and what are the latest trend. He won't be aware with all of this information, and without the updated information about the prevalence rate, incidence, epidemiology, and even treatment modalities, he cannot be a good psychologist. Usually people think that a clinical psychologist doesn't need hard work, and they don't need to do research because research is so complicated, but that is not true. A person who is a good researcher as well as psychologist can be a better option than being only a psychologist. So, clinical psychologists employ research paradigm to examine psychopathology and efficacy of therapies, as I have mentioned earlier. Apart from this, the range of psychologists interested in clinical science is quite broad. For example, I want to check the efficacy of acceptance and commitment therapy for depressive patients. So I can conduct many experiments to see its efficacy and recommend other people to use the same particular therapy in the same way in their clinic. So yes, it has a broad domain. So the goal of research in psychological science is to advance our understanding of human behavior and treatment outcome for behavioral and mental health problems, which is very obvious. Apart from research, another activity the clinical psychologists perform is teaching. Many psychologists are not interested either in research or even in providing therapy, so they prefer to be a teacher. And in teaching, they serve as a faculty member in any college or university. Furthermore, what they do, they teach the graduates and undergraduate students in any university, and teach them abnormal, clinical, theories of counseling, psychological testing, assessment, clinical psychology, and personality theories. These all subjects they prefer to teach to their graduate and postgraduate students. Furthermore, they supervise the students in their research work, like they supervise thesis, they supervise internship, and many other academic activities they perform, like paper publication. For example, they check the efficacy of any therapy, so they prefer to share the details with other people that do not make these mistakes while using the therapy. So they publish their paper so that all of people get to know about the right use of therapies. Okay, so apart from teaching, the last role, which is very obvious, all of you know, clinical psychologists also provide their services as consultations. So what they do is they may work as a consultants in research, academic, and clinical setting. They offer their services to guide the student, the academicians, and researchers to excel in their particular field. And again, in that particular field, they provide direct services in assessment, treatment, and evaluation. So these were the 5 key roles of clinical psychologists. They can perform in any setting, like organizational setting, clinical setting, or experimental setting. So the patient can get benefit of it. Okay, so now we will move towards the clinical psychology terminologies. So these are the terminologies which all of you should be familiar with for the better understanding of DSM-5-TR. So the first word is diagnosis, and it means the criteria which we can use for the identification of illness. Basically, this is the criteria for the identification of illnesses. And as I told you earlier, DSM-5-TR has revised the diagnostic criteria of multiple disorders. So these diagnoses will help you out to understand the different sets of disorder. Okay, the next point is onset. Onset represents the beginning of symptom, when the symptom first time appear, and how it started is known as onset. So the next terminology is etiology, which represents the all the contributing factors which contribute in the progression of disease or leading the disease into severe form is known as etiological factors. Now there are some stages which represent the symptom severity. For example, the first terminology is prodromal stage. Prodromal stage represent the early stage of diseases in which the sign and symptom of diseases are not clear, but it does present but not in identifiable form. And apart from prodromal, there is the acute phase which represent the clear visible sign of diseases, like you can see a person and identify he is suffering from schizophrenia. But in prodromal stage, you can just see he is having hallucination, or maybe you are not sure if he is having schizophrenia or not. Apart from acute phase, there is a residual phase which represent that the symptoms have recovered. The person is no longer suffering from any disease, but there are some symptoms which are sometimes visible, like prodromal stage. Residual stage is also having symptoms sometime appear and sometime disappear. So next terminology is epidemiology, and in epidemiology, we can see the incidence, occurrence, prevalence of any disorder, or any disorder. Uh, Yes, epidemiology basically refers to what are the rate of occurring, the incidence, prevalence, etiological factors, and any treatment modality which is being used in particular time period is known as epidemiology. Preference Prevalence basically represent the ratio of any disorder, like what are the current ratio of schizophrenia maybe, or mood disorder, how many persons are suffering from suicidal attempts and suicidal thoughts. So in a particular time period, the ratio of any disorder is known as prevalence. The next terminology is prognosis, which represent the chances of recovery of any disorder or illnesses. Next terminology is prevention, and it refers to the action of stopping any disease before its occurrence. Sometimes it is being said like prevention is better than management. So before occurrence of diseases, taking some action to stop anything bad to happen is known as prevention. Next is developmental period, and developmental period is from childhood, by birth to 18 years of age, and in this stage child is more vulnerable towards multiple diseases. The next point is differential diagnosis, and differential diagnosis represent how a disorder is different from other. It is very complicated to identify how a disorder is different from the other. What are the key features which is making it different from the similar set of symptoms. The next terminology is profound, which is the intense stage of any disorder. Like if I'm saying he is on profound stage, that means he is suffering from the severe, more than severe form of disease. The next terminology is full remission and partial remission. Full remissions mean completely disappearance of any disorder, and partial remission means somehow the symptom of disease have disappeared, or the client has recovered a bit, but sometimes the gap of recovery, time of recovery is very precise. So apart from partial and full remission, the next terminology is comorbidity. Comorbidity means that two or more diseases are occurring at the same time period, and it is very hard to differentiate between. Okay, the next point is recurrent episode. It is very simple, often occurring of symptoms is known as recurrent episodes. And next one is provisional formulation. Provisional diagnosis mean not definite information is available to provide or give a diagnosis to particular disease. For example, if a person is suffering from bipolar disorder and I do not have the definite information that either it is bipolar disorder or maybe it is something else, so I can give a provisional diagnosis to make it to make it a temporary diagnosis. So next one is as associated feature. It is not represent in criteria. These associated feature is not representing in any criteria, but occurs sometimes and significantly, which make it a bit confusing to identify, like what is the particular disorder, is it a part of that particular disorder, or are these are different symptoms. Okay, defiance represent resistance to obey. Like if a person does not follow something known as defiance, and in psychology, many behaviors are considered defiance because they do not show the obedience, maybe. Then the next one is dual diagnosis, and dual diagnosis means that two disorders are overlapping. For example, if a person is suffering from schizophrenia, also he is suffering from substance abuse disorder, so we can give them dual diagnosis because he is suffering from two disorders at the same time. And the next one is specifier, and specifiers are a brief description which provides a detail about types or specification of any disease. The next one is functional consequences. It represented how a person function or day-to-day living is affecting due to particular issue, reason, or disease. Even unspecified, when you are not sure which type is this and what category you should give to something, it is known as unspecified. And after unspecified, the next point is recording procedure. Recording procedure provide how we can give a code to any disorder considering the considering the ICD codes. And atypical symptoms shows that the symptoms are not representative one. Like if schizophrenic patient have delusion, hallucination, and disorganized speech, and catatonic behavior, but sometimes they show mood disorders too. So mood fluctuation would not be a representative symptom of schizophrenia, so that could be known as atypical disorder. So last one is development and course. So in development and course, it means that lifetime occurrence of any disorder can be known through development and course. So these are the key terminologies of clinical psychology. I hope you are familiar with all of them now, because we are going to encounter all these terminology in multiple diagnostic criteria, and once you are aware of it, so it wouldn't be hard for you to understand the key changes. So the next section of today's lecture is introduction to DSM-5-TR. So before starting introduction to DSM-5-TR, I would like to clarify a few things.